Desmopressin, also known as Ddavp Solution, non-dash, is a medication used to control the amount of urine your kidneys make. It works by replacing a low level of vasopressin, a substance in the body that normally controls the amount of urine you produce. This is particularly helpful for people with water diabetes, diabetes insipidus, certain types of head injury, or brain surgery, where the body does not make enough vasopressin. By regulating excessive thirst and urination, this medication also helps to prevent dehydration. It's important to note that desmopressin products applied in the nose are no longer recommended for controlling nighttime bedwetting in children due to the increased risk of developing a serious side effect, specifically a low level of sodium in the blood. When taking Ddavp solution, non-dash, it's crucial to follow the prescribed dosage and timing as directed by your healthcare provider. This will ensure that you receive the maximum benefits from the medication while minimizing any potential risks. Always consult with your doctor to determine the best time to take this medication based on your individual needs and medical history. When using Ddavp solution, non-dash, it is important to carefully follow the instructions provided in the patient information leaflet and by your doctor. Typically, this medication is administered through the nose 1 to 3 times a day using the provided tube. After each use, the tube should be washed with water and shaken dry. If a child is using this medication, it's important for a parent or responsible adult to supervise and assist with the administration. It's important to limit the intake of water and other fluids while using this medication, especially for children and older adults. Your doctor can provide specific guidance on this. If you find that you are drinking more fluids than directed, it's important to notify your doctor right away. The dosage of Ddavp solution, non, is determined based on your medical condition and response to treatment. It's crucial to adhere to the prescribed dosage and not use more than directed. For best results, use this medication regularly at the same time each day. If there is no improvement in your condition or if the medication stops working effectively, be sure to consult your doctor. Some common side effects of Ddavp solution, non, include headache, runny or stuffy nose, nausea, upset stomach, flushing of the face. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this drug is possible. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects, so if you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. As for the optimal timing of taking this medication, it's best to follow your doctor's instructions. They will advise you on the best time and dosage for your specific condition. It's important to be aware that taking Ddavp solution, non, can rarely lead to a low level of sodium in the blood, which can be serious or even fatal. Factors such as drinking too much liquid, using certain medications, being 65 years or older, or having certain medical conditions may increase the risk of low sodium. Before starting this medication and while using it, lab tests such as urine tests and sodium blood levels must be done. If you experience symptoms of low sodium in the blood such as nausea, vomiting, headache, muscle weakness/cramps, unusual tiredness, unusual drowsiness, dizziness, restlessness, mental/mood changes including confusion/irritability, be sure to inform your doctor right away. Additionally, seek medical help immediately if you experience very serious side effects such as seizure or trouble breathing. As for the daily dosage and optimal timing, it is important to follow your doctor's instructions. This medication is taken by mouth, usually 1 to 3 times a day with or without food. It is best to take it at the same time each day. Be sure to drink enough fluids during the day to prevent dehydration. Are you considering using Ddavp solution, non-dash? Before using this medication, it's important to discuss any allergies you may have with your doctor or pharmacist. This product may contain inactive ingredients that could cause allergic reactions, so be sure to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, high blood pressure, heart problems, conditions that may increase your risk of fluid/mineral imbalance, or if you have any changes inside your nose. If you become dehydrated, your doctor will correct that condition first before starting treatment with Ddavp solution, non-dash. It's also important to limit alcohol intake, as it can interfere with how well the medication works. Additionally, be aware that children and older adults may be more sensitive to the side effects of this drug, and pregnant or breastfeeding women should only use this medication if clearly needed, after discussing the risks and benefits with a doctor. It's important to be aware of potential drug interactions with Ddavp solution, non-dash. These interactions could affect how well the medication works or increase the risk of serious side effects. Be sure to keep a list of all the medications and herbal products you use, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. Some products that may interact with Ddavp solution, non, include tolvaptan and water pills, or diuretics such as furosemide. If you are taking any of these medications, be sure to discuss it with your healthcare provider before starting Ddavp solution, non-dash. When taking Ddavp solution, non-dash, it's important to follow your doctor's instructions carefully. This medication is typically used to treat certain types of diabetes insipidus and bedwetting in children. The dosage and timing of this medication will vary depending on your specific condition and needs, so be sure to follow your healthcare provider's guidance for the best results. If someone has taken too much of Ddavp solution, non, and is showing severe symptoms like passing out or trouble breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the US, residents can call 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe or persistent headache, confusion, drowsiness, and sudden weight gain. It's important to seek medical help if you or someone else may have overdosed on this medication. It is important not to share Ddavp solution, non, with others. Your doctor may also require you to undergo lab or medical tests, such as urine tests and monitoring your sodium blood level, while you are using this medication. It is important to keep all medical and lab appointments and consult your doctor for more details. If you take Ddavp solution non once a day and forget to take a dose, take it as soon as you remember. If you don't remember until the next day, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. If you take Ddavp solution non more than once a day and forget to take a dose, take it as soon as you remember. If it's close to the time of your next dose, skip the missed one and take your next dose at the regular time. Don't take a double dose to make up for the missed one. When you have Ddavp solution, non, it's important to store it properly to maintain its effectiveness. In the US and Canada, you should keep it in the refrigerator, but be sure not to freeze it. If you're traveling, the US product can be stored at room temperature away from light and moisture for up to 3 weeks. After that, it should be discarded. Always keep medications out of reach of children and pets. When it comes to getting rid of expired or unused medication, never flush them down the toilet or pour them into a drain unless specifically told to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.